on. Marmar, thanks for letting me see your face. You look beautiful as ever.
Thanks.
I'm going to go ahead and get started, guys, because it's a long presentation. Do know that I'm going through many different product lines quickly. You can ask some questions at the end and take some notes, but I will send out the recording after I get it shrunk from our IT team. So just know that if you miss something, you can play it back. So I'm going to go ahead and share screen. And we will start from the beginning. So basically what we want to do is just walk you through an overview of everything that you can offer as a partner with VMD. Can someone let me know if you can see slides?
I can see them.
Great.
Yes.
Thank you. Thank you. Okay, so most of you know our capabilities statement. These are on the share drive as well. So if you ever need these for someone that says, who is VMD? A great thing to do is to send them to vmdinc.com, where all of our products are displayed by manufacturer and by department type. There's an About Me section. You can proudly tell them the story of Gardner Rogers, who is our business partner, who's 93 and was a full-blown colonel in the Air Force. And his photos from some of his planes that are behind me as well are on our website. Then our list of manufacturers, and we'll hop right into a cold call. So if any of you have been in the field with me, you'll know that when we walk into a new location just to simply cold call, one of the things that we make sure that we do is let them know who Veterans Medical is. So hi, I'm Debbie Grout. I'm with Veterans Medical Distributors. I'm your local support. We are a service-disabled, veteran-owned, and women-owned small business. We've been in business for over 25 years. We represent American-made manufacturers, and we pride ourselves in finding those difficult-to-find or back-ordered items. So if you have something that you're looking for, please let us know. We have many suppliers we can access. And we also look for innovative products for veterans and their caregivers. We know that VAs and Department of Defense are sometimes the last to have access to new technology, and we want to make sure that you're minimally at least aware that this new technology exists. So this is on the share drive as well, just to give you an idea of kind of how you can represent yourself as a local support for Veterans Medical. But hopping into Preventagen, this product has been on our federal supply schedule for quite some time. Dr. Awad at Houston VA has studied over 284 patients as a general surgeon and chief of surgery at Houston VA. And with the 284 patients, he's actually only had one minor surgical site infection in a year and a half. They were running at, I think, a rate of about a 1.5 to 2% SSI in the OR. And you can imagine going down to basically zero over a year and a half, with our surgical site infections ranging anywhere from $13,000 per patient or readmittance to actually, unfortunately, having patients pass from them. So very important product. Preventagen is indicated as a surgical site infection product. You see it there in the ampule. You simply squeeze it to break the glass within, and then that clear liquid will come out. You apply it over a subcutaneous stitch, and it kills everything on contact. All virus, all fungi, and all bacteria. Excuse me. It then seals and gives a covering that is very elastic. You can actually put it over a balloon and it would expand with the balloon. So it does not get brittle. It does not have any skin irritations as well. We've had no known side effects from Preventagen in the millions of patients we've tried it on. It's going to protect the site from water, dirt, or oxygen getting in. And then it's going to it's going to lower the pH, and that helps with the healing. And you'll see that here in some of our videos. This is just a screen of all the bacteria, fungi, and virus I mentioned that Preventagen kills. There we go. And this was actually one of our reps' fathers. He is an oncology patient, simple bandage removal with sensitive delicate skin from the treatments that he's been going through caused a wound. We had it debrided to what you see here on the left bottom, and after 1 day with Preventagen, you can see that healing. Something to keep in mind when it's used for wounds, that it does sting the first 5 seconds as it's doing its job. It's quite a burn. And about 5 to 10 seconds, that's over, and it'll leave that polymer coating on for 5 to 7 days. That being said, if you have an injury like this that is on your hand and you're using your hand and washing your hand frequently, it may only stay on for a day or two and you would need to reapply. But this gentleman that had an ice hockey injury, we used Preventagen, and this was just simply 4 days later, but we did have to apply once a day due to him washing his hands and using it frequently.
Debbie, can I make a little comment here? Can you go back on the list of agents? Because there might be an angle here from a sales standpoint. If you go at the bottom of the list of bacteria, VRE, vancomycin resistant, and drug resistant strep, these are and methicillin resistant MRSA, right? So VRE and MRSA on that list are big offenders. They're very difficult to treat. They required most of the time several antibiotics, and some of them are only giving in an IV form. So if you can prevent those VRE and MRSA, this by itself is a very, very big deal. So when you talk to your customers about the ability of Preventagen to kill some bacteria, I would underline the fact that MRSA and VRE were proven to not be able to survive in the Preventagen area. So Preventagen works really well for MRSA and VRE. Those two are especially important because if you give them a very large list, they might not pay attention. If you talk about MRSA and VRE, you will get their attention.
What a great helpful point, Dr. V. And also to note that when they ask, what is this going to replace? There's really nothing else on the market like it. But if they wanted to replace Dermabond, which is a known skin irritant, you could, as long as you're doing a subcutaneous, this is not a glue. It does have some glue-like properties, but we do not claim that it's a glue. And so we do need that subcutaneous stitch, but it's not going to have any of the brittleness or the skin irritations that Dermabond has, and it's less expensive. Just to end, this is one of our friend's daughters who fell on a curb. 4 days later, you see the healing is remarkable. So even though we're not indicated for wounds and plastics, you can see how great the product actually works, especially in the face and forearm area. Brad from Preventagen, Dr. Awad, Dr. Hanley, they're all available to get on calls with your physicians to do a physician-to-physician call. Dr. V is educated on the product. We can always reach out to see if he may be available, but definitely want to be talking about the rates of MRSA and VRE and readmits from surgical site infections and where you could potentially save them some money with Preventagen. And if you need samples, please reach out as well.
Here to go back to the Dermabond question, because that's going to come up for sure, right? So tell me more about the VA Houston experience with the product. Are they still using Dermabond, or are they replacing Dermabond with Preventagen, but then they need to do a subcutaneous layer of closure?
They've replaced it, except for perhaps in the ED, where they have mild lacerations that they want to use it on to close.
Okay.
It was essentially initially made for children, for a quick closure for children, and it just evolved due to Ethicon's promotion of it to this surgical closure. So their CPRC paperwork indicated that they would remove Dermabond and replace it with Preventagen and a subcutaneous stitch.
Okay. So be prepared to, to answer that question of we're using Dermabond. What are we going to need to do now if we're using Preventagen? And the answer is you don't use Dermabond, you do a sub-Q layer, and then you add Preventagen on top.
That's perfectly said. Perfectly said. All right, jumping into what is probably our #1 product line. So Hydro Grabbers from Protection Products is a absorbent pad that comes with either a poly backing or a non-poly backing. And you see in this top picture here that it's actually on a roll with a rolling stand. What we like to do in order to drive sales is to provide your customer with a sample pole. And what I've asked Bob to do is instead of sending an entire roll of product, because it could take them quite some time to go through that product when they are not aware of all the uses of it, I'm asking him to send just 10 sheets because it is on the roll, like a roll of paper towels where it's perforated every 2 feet. This way they can choose the size that they need for the job. You can see here in the flooring at the front door, this is at a VA where they get a lot of flooding in through some of our rainy weather. And so they just lined around the black carpet to absorb that extra water. And they chose the size that they needed to adhere to the size of the mat. This is a storage room where they have fluids. They want to prevent the staff and keep this underneath the mop bucket dry. And then under sinks at the bathrooms, other doors that may have leaking. And of course, sterile processing is probably our largest user. The call points for Hydro Grabber, and I have to sneak past that one, sterile processing. So they're going to use those. The poly-backed will go on a dry floor. That poly backing will actually adhere to the floor and prevent it from sliding. So if the floor is dry and they want to prevent slips and they want to prevent water from getting to the floor, they would use a poly-backed mat. If the floor is already wet, they're going to want to use a non-poly mat, and that will dry from the bottom down and the top, or the top up and the bottom down. So two different types depending on the type of job. Most of our facilities do buy both a poly and a non-poly, but it does require some in-servicing. Otherwise, you may have a slip and slide situation with a poly-backed mat on a wet floor. But remember, reaching out to our manufacturer, Bob Palumbo, he will get on a phone call with you and walk you through the sales pitch. He will send you any samples that you need. Dallas VA is actually ordering some custom mats. We have a mat for sterile processing that has a taped edge all the way around. They come in a 5x5, an 8-foot, 10-foot, and 12-foot mat, and you can put them outside of the cart washers, which are notorious for, as you bring that cart out of the washer, you leave a trail of water behind, and that's where our staff is slipping and falling and injuring themselves. So these taped edged mats, with the caution, of course, as you see already displayed, will hold up to 2 to 3 gallons of water. So an enormous amount of water, adhere to the floor, and really show that caution that they usually bring in like a V stand or something to show that there's a wet floor. Again, we use them in sterile processing. We'll use them in the OR if it's a fluidous case or near the scrub sinks. Environmental services will line the doors if there's flooding, or under ice machines, under their floor cleaners. When they park them in the hallway, the floor cleaners tend to leak, and they'll put a mat underneath the floor cleaner. They also have equipment that within the equipment itself, sometimes they'll have leakage down into the battery case, and that will ruin the battery or some of the mechanics of their systems. So they'll put and line Hydro Grabber in there. Engineering, the leaks from plumbing. I've seen them lined in the ceiling tiles so that if they're working above, they try to make sure that nothing goes through to the next floor. These mats will also hold sludge, battery acid, and grease. So we've sold them to transmission shops. I feel like there's a great need for these in airports. If anyone can crack an airport, bring in your rolling stand. Anytime that there's a spill, someone drops their juice box, it's a long time before maintenance crew can get there. And if they had stands nearby that they could just simply roll over, tear off the size they need, they could get that floor cautioned off and dried up quickly. And then the kitchen around the sink areas is another great opportunity for the floor mats. Sticking with engineering and EMS, I'm going to go into our Defender Pro products through Auto Sand. These Defender Pro socks, I have to tell you, I use them myself in our garbage cans because we do eat a lot of seafood, and those shells, while you're waiting for your 2-day-a-week garbage pickup, can really create a stink. It's a citronella inside of the sock, It's pretty pungent. So what I always recommend is if you get a sample bag of socks, to take them and open it up and put them into individual baggies, because you're not going to want to give away an entire bag of, say, 4 socks. But if you don't also want to bring a very pungent sock into somebody's office, so you want to keep it bagged up. But what I like about these socks is that they can be used with the little zip tie in garbage areas, in ventilation. And what we have found, while we can't say or indicate that this is an indication for use in IFU, they do repel insects and rodents. So I've seen them lined in near canteen areas or food service areas up in the ductwork, just to keep the rodents away and to keep the insects away from garbage cans. In addition to the sock, which is probably our #1 seller, there is the granule that you see there in the gallon jug, and that you just simply can sprinkle around dumpster areas or around toilet areas, and it will absorb that fluid. There's a drain treatment product that actually will break down molecularly, and then the twist air fresheners that you'll see here in a second. So these are the socks. They come in a 4 foot long or 6 inch long smaller socks. So depending on what the application is, they have 2 different sizes. This is the granule that I was talking about that you can just simply shake around dumpsters, trash cans, ashtrays, those types of areas. The drain treatment, which breaks down odors molecularly. So it's going to be a thick gel that goes down the drain, and it actually eats the fats and grease that are inside those drains that kind of attract the fruit flies, and that's what creates the odor. So it's a great drain treatment product. And then there's another odor control predator, which can go down the drains as well and eat up the bacteria spores to keep it molecularly friendly. A great product, now this is one that you can bring into an office without a baggie, is the Twist air freshener. What's unique about Twist, as opposed to all the other air fresheners, you may have walked into a bathroom before where it kind of spits on you as it's giving the fragrance for the room. Twist is just this simple canister that does not require a battery. That's key. It sits in these canisters up here at the top, and you put it next to the door of any room that you want to have the natural fragrance, and the air wave from the door actually promotes the fragrance from filling the room. They're delicious flavors. You can get a sample box of the different flavors, but usually what we do is just ask on all of these products for them to buy a couple of cases to try them out. But I know a lot of reps that have carried these in their car, and they love the fragrance they have in their car. It's a very big deal for maintenance workers to have to go to every bathroom, every area that there's an air freshener, check to see if they're working and change out the batteries. Twist air fresheners, the inserts can be replaced every 60 days. So you're saving your maintenance team quite a bit of time. I'm going to go back just a bit here to Dematec. Very quickly, I want to remind everyone that we do represent Dematec, which is the USA-made sutures. Why this product is very important is because it's the 3rd largest suture company in the world. So not just internationally, but nationally in the world. They have all the SKUs to cross-reference to Ethicon sutures, and they are a fantastic complement. What we recommend, especially in the VAs, which is majority of what we are going after is the VA business, is that you just simply ask for a list to cross-reference. And if they're having any troubled product SKUs, so very often Ethicon will discontinue a SKU, or they're on back order or recall. And that's where we can step in and offer them an alternative. You can bring in a sample. Dematec will do the cross-reference for you, but it's nice to say that you can represent an American manufactured suture, and they offer a 15% aggregate savings.
So Debbie, allow me to just add to what you just said here. I think this is very important. I was with you when we went to visit Dematec in Florida a few weeks ago. And the key here is that the current companies that are providing sutures, the #1 and #2, they have significantly reduced the number of offerings that they used to. So they used to basically offer 20 or 25 different sutures and length and strength and sizes. And they kind of consolidated that into anywhere between, 5 and 7. So that's the opportunity through the skew angle. So if you go in and you say, hey, I know that you've been having issues getting specific SKUs for your doctors here because your main suppliers are not producing those sutures anymore. We have a way here to provide you the same suture, and it's made in the USA, and it's through this company called Dematec. Please give me the SKU that you have a hard time getting now. And I think this could be a fabulous way to get into those accounts. This is a real problem. I actually researched that personally after we did the visit with several surgical friends around the country. And they've been having problems getting supply of sutures that they're used to. And often, they'll give them an equivalent, but the equivalent is not the same. And doctors are creatures of habit, especially surgeons. They're creatures of habit. And anything that changes can actually lead to a bad outcome or an infection. And they don't like that. So if they've been successful with a specific suture in a specific SKU, actually, I would use that angle to get in and provide that product now that they can't get any other way.
And keep in mind that we don't have full access commercially to Dematec sutures because they do have a sales team for that. However, if you have an opportunity, please bring it to me. We've been converting a lot of surgery centers because their reps have not been in the surgery centers. I'm working with Aventis West because I have a contact and it's a large system. So bring the opportunities to me, but any list that you can get from the VAs and to bring up what Dr. V just mentioned from a surgical perspective would be really helpful. Clean Patch from Sanitas. So this is a unique product. I used to sell a lot of mattresses and a lot of jelly rolls into the ORs and around the hospital beds. The problem is that they tear, the scalpels will nick them, instruments will nick them, just transportation, the abrasions, and you get rips and areas where then blood and contaminants can get into the product or the mattress. That is an infection control no-no. It's an inspection no-no. The inspectors actually come through and look at the mattress graveyard or the mattress areas and will look to see if they have any that require repair. And if they are not fixed by the time they come back in a week, they could be written up. One of the things that I've offered to do prior is to go through their mattresses and do an inventory for them and just jot down by the room, take a look at the mattress, let them know if any I think need to be completely replaced or if we think that Clean Patch could solve the problem. So Clean Patch comes in a mattress cover, a vinyl cover, and a jelly roll cover that is the only cover that is FDA approved to fix an area instead of having to replace an entire mattress. Here's an example of an x-ray table with a vinyl patch. And then here's a picture of a jelly roll where we're able to put a patch over the jelly roll. If there are several nicks and cuts, of course, you're going to want to offer to replace them, and we could give them a quote to have them replaced, but having them purchase some of the clean patches to have on hand before an inspection could save them the time and effort that goes into them having to come back out and be re-inspected. So Clean Patch by Sanitas, and they will send you samples as well. Microdoc. So Microdoc is a single negative pressure wound treatment device, and it's the only device that offers 3 pressure settings at 50, 80, and 125 that is in a portable unit. So we do have another product, Extra Care, that is in 3 settings, but it's the canister, the suction canister, not portable like Microdoc. So this is a great alternative to smaller wounds where they can just simply apply the bandage, the tubing, to the pager-sized Microdoc setting, and it will let the doctor know, it'll alarm to them if you're saturated or if you may need to change the setting. And it's very simple to use, and it keeps the patients mobile post-surgery. The BioWound team has two regional managers, one on the East Coast and one on the West Coast, Bill and Richard, and they are fantastic. They have a lot of contacts. They will come to your VA with you and do some cold calling and also attend some in-services. We are in and approved at several VAs already across the country, getting into Department of Defense. But the reimbursement on this commercially is very minimal. So it's not necessarily something that our docs have been looking for commercially, but you do have it available. Graham Field is a furniture partner of ours. They do a lot of American-made durable medical equipment and furniture. So anything from exam tables to lifts, wheelchairs, exam chairs, and a design center by which if you have someone that's opening a new surgical suite, they're redoing a community living center. Graham Field has designers that can come in and take a look at the room. They can do measurements, provide color swatches and a schematic to help them compile an entire list of products to fill that area. I like to offer these solutions in what's called a custom, a CIS, a custom, well, actually it would be a furniture solution, CFS, custom furniture solution. So if we were to outfit a waiting room, instead of having them purchase the chairs, the end tables, the pictures, the magazine racks, and some end tables, we can just simply give it an item number of waiting room 1. And the bill of materials is everything that I just mentioned. And then we do the work of managing the POs to the vendors that we may need to fill that waiting room. And they're only having to order one item. We like to be very solutions oriented. So maybe we even put in a shipping and handling charge where these are delivered to a local area near you where you can uncorrugate things, get them assembled, have them redelivered, and remove some of the other furniture. Lots of things that we can do to be solutions oriented. Just keep in the back of your mind that we have these options. Blastex is an antimicrobial wound gel. It's the only thing on the market right now for removing biofilm. This is a Med-Surg Prime Vendor product. So if you remember, Med-Surg Prime Vendor is the highest contract by which VAs need to place their supply orders. They order 90% or their goal is 90% of their spend through Med-Surg Prime Vendor, and you represent a product that is on Med-Surg Prime Vendor. This is exceptionally important to remember because if you're visiting your VA and you want to get into logistics, you can let them know that you represent products on Med-Surg Prime Vendor, like this product, Blastex, which is very important in the doors of wound clinics, podiatrists, for the prevention of additional biofilm and bacterial growth. Most people are familiar with Blastex. It's just a matter of you taking your brochures and your business card, letting them know that you represent them, do they have any questions, and that you're here to support them locally. Pressure ulcers, this is just very sensitive and going through quicker than my mouse is allowing, but wounds and donor sites, burns, and post-surgical are all indications for Blastex. If you need one-on-one clinical support, Blastex is available to help you as well as the manufacturer. Foot Defender. So it may look to you similar to a Nike shoe or sneaker that you've seen in the past, and that is because there was a Nike designer that was involved with the design of this boot. So compliance is one thing that's very important for podiatrists and wound doctors with their patients. Having something that looks sleek and interesting to wear helps with compliance. In addition to, you'll see there at the top that it's a Velcro closure. Those 3 straps are all Velcro. Not only is that important for patient compliance and for the patients maybe with dexterity issues to get that on and off, but it's your nurses in clinic that are having to take those boots on and off as well. So something that is easy for them is always helpful. And then you'll notice also the flat design on the bottom. A lot of these boots for the prevention of diabetic foot ulcers at the toe area and the heel have a rock to them. So as the patient steps, they're actually putting pressure on the heel and the dorsal toes. So this flat boot prevents that pressure in the areas that we're trying to prevent a pressure ulcer. And you can see here on their flyer that the pressure mapping indicates that Foot Defender actually has the best results for a reduced pressure in those areas. There is a special gel that's on the inside of the insole that you can actually take out and show to the doctors. And if needed, there's a button on the side that can, if you press it, it'll tighten a little bit to the calf if needed. Foot Defender comes through SDV USB called McLean. They asked us to represent them as their sales force. And so if that VA is not buying Foot Defender today, then you have the ability to sell it, and but it's ordered through McLean. So it's on FSS contract. Commercially, you can sell it anywhere you want, and there is reimbursement. The team, Dave and John Martin in the field, are there to help you, but it's a really important product for the prevention of diabetic foot ulcers. Sticking with wound care, Mimosa Pro on this Friday evening is not the drink. It's actually a wound image device. And so Mimosa tags line is making the invisible visible. This is the size of a cell phone, and you see that camera there at the top. It's actually an infrared and near infrared camera light that will take an image of a wound. It actually transmits the image through the cloud to an email. So if you have home health or nurses on a certain floor or building in a CLC, and they want to send an image and get a diagnosis from a physician on how to treat that patient, it can be sent over the web just by connecting to the internet, and then the doctor can diagnose and send that back to the nurse or the nurse practitioner. We have an IHS facility that does street med. You can imagine how important it would be to be able to take an image in the field of the homeless, send it to the doc, and then understand how to treat that patient, or should you actually be bringing them in. It actually does 4 things in one now. It says 3 here, but it does 4. It sends that digital image and it captures it, which is great for when you're preventing clawbacks from skin subs. You want to have digital photos of that wound week after week. It takes a vascular reading. So you'll see there the color coding. It'll read the oxygen level of a wound all the way down to the specific area. So you can actually touch on the photo and it'll give you the percentage of oxygenation. So if they're doing a proposed amputee of a toe, amputation, they can check the remaining toes to make sure that they are getting some vascular flow, or to see how far they need to do an amputation. Also, with that, in vascular cases, they can actually bring the camera into the OR to make sure that the procedure or the ablation that they're doing, they've gone to in the procedure of done the vascular repair that is necessary, and they're now seeing that blood flow. It also will take a temperature reading, and you can touch on the image itself to show the percentage of temperature at each spot, as well as the color coding, and that's going to be your indication of infection. So being able to prove and show the wound progressing from a vascular point, an infection point, and a digital photo. The last new capture is measurement. So it is able to measure the wound and show the progression and hopefully healing of the wound from week to week. The device is reimbursable, albeit it's a very low amount, and the device can be purchased as a rental or an outright purchase. So this just gives you a picture of the clinician taking the image. It's going over the web, and then they're getting the treatment recommendation. They do a great job of presenting virtually. If you have an opportunity, don't hesitate to reach out for Vicki or Jack to present. We also offer Viradex and Febridex. So Viradex is a flu A, flu B COVID test, 3-in-1. It can be reimbursed as all 3 tests with the purchase of just 1. And Febridex is a viral versus bacterial acute respiratory, ARI, infection detection. So imagine during COVID when we had flooded ERs and urgent cares, if they were able to give this 10-minute quick test, they would be able to tell them whether or not they should just go home and have some chicken soup and Tylenol because it is not bacterial, or if they actually needed an antibiotic. So 2 quick tests that are reimbursable. We've had a tough time getting them into the VA because the laboratory likes to control the diagnostics of these tests. And since we haven't had flooded ERs again, we haven't been able to bring that rapid test into the point of care. So if anyone has any relationships there, we'd be interested to see if we could talk through and understand how we might be able to help in a VA setting. And then this is just the reimbursement and the CPT codes. A very interesting line that you would see at Walmart and online and at CVS is our Radius Oral Care. Radius is a American-made company, woman-owned for over 40 years. Their products are all sustainable, reusable, biodegradable. They are backed by the ADA, the American Dental Association, and Saskia is the daughter of the family that started this product, and she stands behind her products 100%. She's fantastic. Why we present Radius is because of this ergonomic design, especially in the VAs with our patient population that may be going through stroke and rehab. They may have conditions like ALS or Parkinson's. In active duty, anyone that's going through rehab or perhaps had an amputation. This handle gives you a nice grip for your thumb and the palm of your hand, and the angle of the toothbrush actually fits perfectly into the mouth to get a good dental hygiene clean. Disease and flu and COVID are all spread from lack of good oral hygiene, both in the community living centers in the VA and just their personal use. So this bristlehead, as you notice, is a patented size. It's wider than most toothbrushes with 200 to 300 more very soft patented bristles. So you're cleaning not just the teeth, but you're also massaging the gums at the same time. So remember back to the patients with perhaps MLS or a stroke rehab patient. They're not going to spend a lot of time, most likely, brushing their teeth. And so the time that we have, we want to make sure we've got the best surface area and that we're getting those gums as well. They also like the autonomy and the dignity of being able to have a device that allows them to brush their teeth on their own again, rather than using a caregiver. I've had dental chiefs that actually stopped me in line at Starbucks in the VA because they saw this toothbrush in my hand or my bag and said, my nurses are wrapping foam and duct tape around the handles to create a utensil that is appropriate for some of my patients to use. I've been looking for this. So make sure you're dropping these off not only into your dental locations, but into your OT and PT as well, as they're rehabbing patients and getting them back into their normal day routines. You'll see on the right here that one of the brushes, the source, is actually a teardrop shape. So if you don't like the ergonomics of the big brush, you can go for the teardrop. It does come in a left and a right-handed toothbrush, which you can imagine for our lefties would be very advantageous. And then it also comes in this teardrop-shaped bristle. Those bristles, you may know, are replaceable. If you'd like the smaller bristle head on the bigger handle, you can interchange them. And instead of throwing away your toothbrush every month or however often you replace, you simply keep the handle and replace the head. We have 8 million toothbrushes in landfills around the world. And so this can help with some of our environmentally sound VAs. This is a snapshot of everything we carry on the Radius Oral Care portfolio, from 6 months of age all the way up to our big brush and our source. There's also a travel brush that folds into itself, and my spinal cord injury liked the fact that it had 3 pieces in one. They thought it would be a better grip. And we've also noticed that our dentists really like the floss. It's a certain type of braided floss that they have been looking for that can do a much better job of clean there. The toothpaste is a elderberry, vitamin A, vitamin C, great for the prevention of pneumonia without fluoride. So there are many consumers and staff that are concerned about the effects of fluoride. And so this is a great one for preventing pneumonia and the spread of viruses with an immunity toothpaste. For the kids, we've got coconut banana, dragon fruit, and some other flavors, which of course they really like. There's, in addition, you have access to a pet care line. And then we do have display opportunities. So if you were calling on a dental group or you were calling on a veterinarian, sometimes they may want to put up a display and actually resell the product in their storefront to keep their patients coming back. Those are available with samples as well if needed. Quantum Medical is our storage solutions. You can see in the back there the wire shelving, the acro bins, which come in many colors. You'll hear blue bin a lot, but most of our customers these days are like opting for the clear bins. They want to be able to see the dust if there's something that needs to be cleaned out. Quantum Medical also has the different types of suture carts, wall shelving, basically everything that you need for storage solutions, stainless steel, the kick stands for hamper stands, procedure carts. The most important thing for you to sell Quantum Medical is simply to let people know that you have it. I've put the QR code and sent it to all of you with a link to their catalog because it's a very big catalog. Many of you received some samples in the mail of the different types of bins, but when you're walking to departments, don't leave without letting them know that you represent storage solutions like Quantum Medical and that you have a lot of things that you could measure and provide to them a quote for, because everyone's looking for a cart or some sort of storage solution. Right now, they're having a promotion on the trash bins. So they have several different types of trash bins on wheels or not, and the recyclable receptacles. If you haven't received information on the training for Quantum, please let me know. Betty from Quantum is available to help you with any questions. Get on a call with a customer and also send people out if you need CAD drawings. You haven't been trained on iMedical yet individually, but they are a company that does bed and equipment rentals as well as refurbishment. I just recently had a request for an OB table, and the refurbished table that looks exactly like brand new, comes with a 1-year warranty, was a quarter of the cost. So if you have somebody that's looking for beds or equipment, please just reach out to me and we'll connect you with iMedical and see if they have something that they might be able to help you with. ScamPro, right now we are in servicing at Orlando, VA, our first pilot. ScanPro is a phone size scanner that actually scans the UDI labels. Since 2016, medical supplies and devices all need to be UDI labeled, and it contains all of the information in the UDI label that's important for logistics. Basically, what happens with your high dollar volume items is that they get put on a shelf, new product gets added, and what's going to expire gets put to the back. And the hospitals that we've worked with are losing hundreds of thousands of dollars in expired and recalled product. So quarterly, they go in and they do a manual inventory check where they literally pick up a box, turn it on all sides, look for the expiration date, manually write it down, manually write down the part number, the description, the SKU, the serial number, and if there's a sterility date. So you can imagine that the expiration date can sometimes be confused with the sterility date, and that leaves you with product on the shelf. Not to mention, it's such a tedious job with rooms that can look like this, that manual process poses a lot of errors. So we come in with the scanners. We scan the UDI labels within a day and a half in all of the areas of the hospital that are needed, and they guarantee a complete return on investment for the cost of the scanner. So if the system doesn't pay for itself in results of locating product that's going to expire, they will write them a check back. We can't do that in the VA, but what we provide are reports that show what's expiring within 30, 60, and 90 days. And they can tell us how they would like to receive these reports. And this helps them to move the product around to either other VAs in the VISNs, other locations in IDN systems, or perhaps to a CBOC and get the product used. It also shows when you're scanning it every quarter what that usage looks like. So they'll know what are their slow movers, what are their fast movers. And we can also tell them where we found a recalled product. So we run this list off the National Recall Database every month, and we'll give them a heads up as to where the last scan was, that they have a product on the shelf that has been recalled. When we have the results from the pilot in Orlando, we're going to publish that nationwide. We'll provide it to you guys with another training. But I can tell you, when we first went in just to demo, we went through one of the OR supply areas and found 26 expired products already on the shelf. If it's a commercial hospital, they actually work with organizations that will buy expired product and resell it to other countries or hard hit areas that may need it. So a lot of opportunities for return on investment with ScanPro. Going into UFirst services. This is a product in my hometown, Buffalo, New York. They offer Lubricity and Metakill. Lubricity is a dry mouth spray. It's the only spray that only has 5 ingredients. It's all natural, uses hyaluronic acid, and it really helps your body produce its own saliva. Oncology, diabetics, a lot of different medications will cause dry mouth. I know this was instrumental for my brother-in-law who had cancer. He was unable to sleep at night without the use of Lubricity. So it's a game changer for those people that have chronic dry mouth. And Metakill is for metallic taste. There's nothing else on the market that will get rid of that metallic taste that you might have experienced during COVID or from a medication. You just swish it and go, and it's remarkable. 2 kind of smaller products, but along with that Radius dental toothbrush line, they make a nice complement together for your facilities and dental. Okay, Dr. V, you've got 25 seconds because we still have some more slides to go, but Dr. V brings us Guardsman Scientific. This is a remarkable ultrasound for cardiology that I'm going to have him walk you through the GPU processing on this and who you speak to with regards to getting a demo set up.
So the opportunity here is very large. It's a $1 billion market every year in the US only. It's ultrasound that specializes in the heart. The reason why we're going after this product line is because I helped Canon Medical rebuild their platform to use ultrasound for the heart. Canon is the same company that you know from printers and cameras, but they also have in Japan medical imaging. So this is way advanced medical imaging, and this is a very specialized medical imaging for cardiologists that are using the ultrasound for the heart. But it's a very large market with no presence or almost no presence from Canon. So there's a big upside opportunity. We carry the entire product line, which has several different price points. There's also a point of care option here called the Flex. And then there's the Ultra Extend, which is the PAX that is attached to it. So we have a very complete line of products that can help support all their cardiovascular ultrasound needs. The key here is when you get access to them is to say, we're the only one who processes ultrasound through a different way. We're using the GPU, the graphic processing unit, to generate all your images. So we're turning medical images into a video game. And that's really the big angle. And that gives unique capabilities. One of them is just by itself gives greater quality images compared to traditional ultrasound. And we also have ability to do contrast without contrast. That's the image on the left, the chamber opacification without contrast. So that's a real big advantage. And the key here, when you get access to these accounts, is ultimately to talk to either the lead sonographer or the cardiology manager, tell them that you have a new product line, tell them about Canon, and then we can come in. We have the clinical support team that can come in and take it over from the clinical standpoint. But we really need the entry point into the cardiology space. So either the lead sonographer, the cardiology manager, sometimes a cardiologist. If it's a smaller practice, it could be a one or a handful of cardiologists running it. And you can go talk to them. We put together a few slides to help you kind of build a little bit of a introduction talking points, and you can review that on your own. But ultimately, it's to tie the Canon brand that's well recognized and say, hey, that Canon brand actually has a vertical into your day-to-day life, into your clinical life. And we think that because we're built differently, we can help you do a better job, better image quality, better patient care, and we can do contrast without contrast, so you can save time, money, and basically do better from a patient standpoint. So allow us to come in and give you a demo. We win by demoing side by side against the competition, which is GE, Philips, and Siemens. So that's that's the gist here. But
one of the things that I hear frequently, team, is that they've just recently purchased new equipment within the last few years. And I say that's fine. We just need to get a demo so that you can be educated on what the new technology is. There hasn't been new technology in 10 years. Sometimes you move to other facilities and knowledge is power. So we want to show you what advantage you can have if you have a patient that cannot take contrast, the cost savings from not having to use contrast, from going from two clinicians to one, and also the healthy sonographer. The equipment is designed ergonomically to reduce injuries because, believe it or not, sonographers miss work due to the injuries from the positioning and the heaviness of the equipment. So we just want to get their input. And we'd like to come in and do a lunch and learn and bring the equipment so we can demo side by side, as Dr. V said, the images you're taking today versus the Canon imaging with the GPU processing. And typically they are open to having that demonstration. The hardest part truly is getting the intake form filled out. You have to keep going back. If you don't get it done right then, and to solidify a demo date, coordinating the demo and the intake form is the toughest part. Dr. V is offering $500 per intake form and then demo. If you get the combination of those two things, you're going to earn $500 just for setting it up in addition to the commission. So this is a fantastic product. It needs to be socialized commercially and in the VA. Let us know who you're talking to and Dr. V will get on with you prior or with your physician or sonographer or cardiology manager to help you through the process of selling this.
Yep. I'm gonna back you up here.
SedMed toilet lift. We just did a big presentation at Bay Pines VA this morning. I won't have time to play the video, but you can receive a video package like this, where you actually have a boxed video version that you can leave behind with customers. And it plays a demo of how this SedMed toilet works. It's the only toilet on the market that is pneumatic. So it doesn't require electricity or batteries. With 2 bolts, it simply goes over any size toilet for up to a 500-pound patient. And it's preventing falls. It's preventing injuries from caregivers. This is what the video looks like. You simply press play and it'll take them through a demo. It's a very nice marketing material piece that is the game changer when it comes to marketing. You can have those delivered and hand them out. We're working with safe patient handling. We're working with community living centers. We're working with home health. We're working with medical supply stores. We're working with inpatient. One of my inpatients at the VA here locally had 27 falls. The majority of the falls are in the restroom. So what happens is the patient goes to sit on this toilet and it shock absorbs and it slowly lowers them down. They lock the toilet into place. You can see there it's got the grab bars. And then when they go to get up, instead of the caregiver having to use all of their lower back to lift up the patient and the patient get nervous, potentially fall back, it will lift 80% of their body weight to a standing position. So whether they're alone or with a caregiver, the SedMed toilet is a game changer for patient care, for the safety prevention. And we're actually presenting to all of Safe Patient Handling in Orlando in January, nationally for the VAs. So if you don't have your video, please reach out and get on a training with Jeremy from SedMed. Today they handed out chocolate toilets and they were dressed in a toilet costume for Halloween. They'll come to your hospital, they'll do demonstrations. We actually did demonstrations in the lobby once and all the veterans wanted to sit on it as well. So it's a very well-received product. Safety neb are safety filters that go over nebulizers. They protect the caregiver from ingesting the medication that's provided to a patient. And also the patient's first few minutes, they'll cough and their germs can get into a small area, whether it's an ambulance or an exam room. The safety filters just simply peel and stick on the side of the nebulizer, or you can buy the nebulizer with the safety filters already attached. Usually ambulance workers like the attached masks, and the respiratory departments in a hospital want to just purchase the filters. Team, these are $1.50 for a pair of filters. They're not a game changer as far as commissions, but it's a nice foot in the door when you want to go talk to them about maybe Sensa Medical irrigation solution that we offer. And it's a nice feel-good product for protecting caregivers and giving the patient a better medical treatment. More Medical is our PVC line. So just know that we have all PVC items, carts and cart covers to stretcher beds and partitions. The key and the difference with the PVC products that we offer is that the packaging is 25% less than the competitors. So what that means is they can hold more, store more, and it's 75% less cost in freight. So they do a really great job. Please come to them with any custom items that you may have. And it's just a matter of letting your teams know, your hospitals know that we represent this because they're all buying PVC. And then lastly, we're going to end with Blue Bin. Blue Bin is a 2-bin Kanban inventory management system. You see the bins here. They don't necessarily, as I mentioned before with Quantum, have to be blue. They can be clear and very often are. Blue Bin, by the way, can utilize Quantum's equipment to redesign these storage areas. But essentially, this is the Japanese 99-year-old system of placing supplies in one bin and another behind it with half of the supply. So if you need in 15 days 10 supplies, you would put 5 supplies in the front and 5 in the back. Clinicians are now not worried about running out of product. They simply pull from the first bin, and when that first bin empties, they put it up to the top and they pull the second bin through. Every day, your inventory solutions team comes through and takes all of the bins from the top. They take them down to a staging area where they scan them, and the scan generates a reorder. So it'll give you turn times, it gives you a 98% fill rate, and it takes the clinicians out of logistics and gives them that peace that they know they're going to have product when they need it. What I like about Blue Bin is that they actually send a team to your hospital that lives there for 6 months to a year and a half. They are going to come in and do department by department design. So they'll go to OR usually first. They'll work with the staff. They'll help them place the items in the order that makes sense for pulling, for efficacy, and for quickness. And then they'll go ahead and do all of the design work. They try to repurpose the equipment that they already have, but they'll also, through you, give the hardware expenditure or quote for how to redesign. They'll do a CAD drawing, and then they'll move to the next department. They'll train each department, and they'll train the logistics staff what's called Blue Belt certification, a blue belt. And before they leave in 6 months to a year and a half, everyone will have been trained, and they'll have some specialists that are blue belt certified to make sure they can maintain the system. So there's a huge reduction in the very beginning. They're able to reduce the inventory hold and the medical supply because, as you know, our nurses are hoarding supplies. They're afraid they're going to run out. They're in desk drawers, they're in closets, and we go into those nooks and crannies, pull them out so we have an accurate read on what's there, and those can either be repurposed or sold to reduce their inventory holding costs. There's a huge improvement in supply chain efficiency, and what's out there in the VA today is PARX. PARX is actually the national contracted product, and what it is it's a weighted shelving system. So the weighted shelving is done by wires, and the wires will sense the weight of a bin, and when the weight changes, it'll tell the team and logistics how many have been taken or if that bin is empty and needs to be replenished. It's a fantastic concept if it worked. It doesn't work. Not only does PARX set it up, leave it, and forget it, they don't come back to do the repairs and servicing, but they're constantly breaking down because it is so intricate. In Orlando, PARX is quoted at 4 million. We quoted Blue Bin at 400,000. So a significant savings, a simplified 100-year efficient program without the issues that you're going to have moving forward with that weighted system. The Omni cells are those caged closed storage areas where you have to put in a code, and the codes are either forgotten or they're shimmied with a card open, and so they never really get a true read of what's available in the Omni cell. So a huge significant savings when it comes to Blue Bin versus PARX. And as I mentioned, that is a lot of information, but it's going to be available recorded, and you can take some notes, and anything that you saw here that you don't have a sample of, that you're interested in a sample, or you want to talk directly with the manufacturer for some more information, you can just simply reach out to me via email and we'll get you connected. Always, always, before you go into an account, reach out, preferably a day in advance. I got a call this morning driving to a dental facility, and so I quickly sent over a few files they could share, but I would have loved to have gotten them some samples as well. So more advance notice, the better equipped we are to provide you with what you need. But certainly if you have these flyers, which are on our share drive, on your phone so you can access them through your files, you're able to show people at a moment's notice, because it's difficult to remember everything that VMD offers. If you don't remember anything we offer, Dr. V would say, remember Canon and his cardiac ultrasound, but just reach out to me and say, hey, I'm walking into a wound clinic. What do you recommend? I'm walking into a long-term care. What do you recommend? I'm walking into a maintenance department. What do you recommend? And it'll start to become more second nature to you, but that's why we're here to help. I know we're over our time, but I want to go ahead and take some time in case anyone has some questions. Great, everybody's experts.
Oh, yeah.
Hey, Robert.
Hear me? How you doing? I have a quick question. I don't remember hearing anything about Cincinnati Medical water inhalation. So my question was real quick. Is that currently on a national GPO?
No, they're not on any GPOs. We're working to get them on contract. The significance of Sensa Medical irrigation solution is the fact that their bags are DEHP free. They're very easy for the clinicians to use. They're very clearly defined as inhalation water. And if you recall, we had that huge natural
Okay.
disaster that wiped out sterile waters and inhalation
Got it.
water. And so as long as you're taking the brochures and you're letting your respiratory and your pharmacy departments know that we have this product available, of course it's a cost savings, but it's not typically on contract. We'd love for them to buy some and try it out, but we want to make sure they know we're here when that natural disaster happens as a backup, in addition to it being a very exemplary product.
Okay, thank you. Could that be prospect at a commercial hospital? Or is that just strictly VA?
You can sell it commercially, yes.
Okay, okay. So, but what I'm finding out is that a lot of times that sell not because of it's not on a listed national GPO, but we can still prospect it.
That's right. You can. Everybody wants to know that they have a backup. So for those of you that are staying on, let me just go over two more products quickly when you have if you have the time. I couldn't put everything into the presentation, but want to make sure you're familiar with new fabrics. This is our capsaicin infused compression sleeve. Capsaicin is a known natural healer of pain and inflammation. Of course, the compression helps with swelling. This is for arthritis, neuropathy, tendon pain, any type of rehab prior to surgery. They come with knee, shin, leg, wrist, and ankle. For different joints on the body, they are fantastic and they should be used as recovery. So I gave him to a doc recently, and he played tennis in the with the sleeve, and he said he couldn't believe how warm it got. 30% of patients will feel that warming sensation from the naturally occurring capsaicin pepper. 30% actually feel cooling, and 30%, like myself, feel nothing at all. So I was able to wear my ankle brace during the day without an issue. My son, on the other hand, is not. He only wears it at night or when he has his foot up. But it's a great product. It's remarkable pain relief. And the capsaicin is encapsulated in the fabric at different thicknesses. So your body's sebum actually releases the capsules over an 8 to 10 hour period. You can wear that per day. And it can be washed up to 15 times because the water and soap does not activate the capsaicin, only your body's sebum. They're available in Walmart and Amazon and Walgreens, but everyone buys them for the same price and sells them for $19.99. I've been offering them to my podiatrists, to my wellness centers, to acupuncturists, at like $14 and letting them know they could sell them for $19.99. It's not a big money maker for them, but what I like is that it's unique, it works, and it can keep their patients coming back to book their next appointment and stay compliant with them. Not to mention the docs that put it on have all found great value for themselves in there. We have a podiatrist that used the wrist due to his tendon issues from nail clipping, and he now is our first to bring it through CPRC and get it approved at one of the VAs here in Florida. And the podiatry team, once it's in-house with its IMF, has offered to take it to the entire VISN. So very important, very well received. It's a great door opener when you're cold calling as well. If you need samples, let me know. And then lastly is the Lumos scalpel. So this scalpel is actually a lighted scalpel at the tip designed by Dr. Hacker. You can imagine for delicate procedures, for dimly lit rooms, in oral cavities, that this is a fantastic option instead of a headlamp or the overhead lighting. Also for episiotomies after childbirth, they use a gooseneck lamp that has burned patients, it's burned physicians, it's very cumbersome, it gets in the way. Your hand can still create a shadow where you're doing your procedure, and so having an illuminated base is very helpful. Our human use scalpels are going to be ready after the first of the year. Right now, we're offering demo product to veterinarians and anatomy labs. So we want to get them in the physician's hands and get some feedback and have them trying it and socializing it while we have these demo units available. And then in the future, we're going to have some biofluorescent blue lights that we'll be able to actually do some debriding of biofilm and wounds with that fluorescent lighting. So there's a lot of new applications to come with the Lumos lighted scalpel. And if you need samples, reach out. Anna Dunford will get on a call with you individually and strategize in your area. She will travel with you. She's doing trade shows. We're getting these onto contracts, and we just need to get it socialized. So she'll offer you free product for your veterinarian schools, which is basically larger than even the VA healthcare itself, and your anatomy labs. Anything else? Okay, well, that being said, trick or treat, everyone. Have a great weekend.
Thank you.
Thank you.